32,000 St. Paul residents will receive a surprise notice in the mail that their medical debts, totaling just shy of $40 million, have been purchased by the city and completely abolished.
It's kind of hard to get your head around that announcement from Mayor Carter in St. Paul this morning. And it's just the first installment of his medical debt reset initiative. Under his plan, the city of St. Paul says it's set to eventually erase $110 million worth of medical debt to St. Paul residents. And that's if they have the requirements, an income of up to 400% of the federal poverty guidelines, and have debt that equals 5% or more of their annual household income. And all of this is possible thanks to a nonprofit, an organization called Undo Medical Debt, that buys debt from health systems at a deep discount. One of the people who stood by the mayor this morning was Walt Myers. He's from Lakeville, and he had a reason for being there. Heidi joins us with his story. Hey, Heidi.
Yeah, Jana, Walt is not personally benefiting from St. Paul's announcement, but we heard from him today as someone who knows firsthand how medical debt can impact someone's life.
Some living room walls can tell a lifetime worth of stories.
Every time I look at them, it just reminds me of, something that we did.
For Walt Myers, it holds memories shared with his wife, Sue.
I can tell you the exact moment my life changed forever. We were sitting on the couch watching TV downstairs, and she touches the base of her left breast, and she says, "Does that feel weird to you?" She was only 39, and she wasn't even old enough, according to our insurance, to be eligible for mammogram. That is the moment our lives changed forever.
Sue battled cancer for more than 2 decades. Then in January 2019, she entered hospice care.
It was always her wish and our wish as a family to stay in the house as long as possible. Up in that bedroom is where she passed away.
3 months of hospice care led to letters upon letters of explanation of benefits.
It was 6, 7 pages, both sides. And unless you know exactly what you're looking for, I defy anybody to figure out what it is they're telling you. Then came the insurance, $135,000 out-of-network bill. And it was, medical billing hell. Nobody knew what to do.
Walt then remembered an interaction with a social worker who mentioned Cancer Legal Care, a nonprofit providing free legal care to Minnesotans affected by cancer. Cancer Legal Care connected with Walt's former employer, and it kept going up the chain.
I just retired, just had a celebration of life for my wife, trying to console my kids, and had this medical debt hanging over my head that was just brutal. It was brutal. I was actually afraid to go to the mailbox and see what was in it. We pled our case and waited. And about a month later, we get a response from the insurance company saying my $135,000 bill was forgiven.
A life-changing moment that led to him volunteering for Cancer Legal Care. Soon, he was sharing his story as part of a push to get the Minnesota Debt Fairness Act passed. The new law took effect October 1st in the state. Among other things, medical debt will no longer be automatically transferred to one spouse. It also cannot be used to deny medically necessary care or be reported to credit reporting agencies.
It's a very meaningful thing. Hopefully, people won't ever be touched by that. But if they're in a situation where they are, they're going to be very thankful for this new law.
Walt's work shining a light on the problem marks another memory on the wall.
My wife would be absolutely delighted to know that after 5.5 years of her passing, she's still helping people.
The Kaiser Family Foundation says about 330,000 Minnesotans have medical debt, and Jana, Walt says he will continue volunteering with Cancer Legal Care.
Yeah, Heidi, you and I have talked about this. You really don't go through your adult life without meeting someone that has this kind of debt through no fault of their own. They just got sick.
Absolutely. And these stories really let you see through their lens how that can really impact a whole family.
All right. Thanks so much, Heidi.